Welcome to This Explainer. Today, we're tracing the incredible history of the Toyota production system. Now, as MBA healthcare students, you're stepping into an industry that is frankly plagued by skyrocketing costs, systemic bottlenecks, and critical safety challenges. So we're going to look at how a desperate, post-war car company practically wrote the playbook for modern healthcare quality improvement.
So, how exactly did a post-war Japanese car company write the playbook for modern healthcare quality? Well, let's dive right into this massive question by traveling back to the economic devastation of post-World War Japan. We really need to understand the environment that forced this innovation. You see, Toyota wasn't born out of abundance. No, it was born out of pure, unadulterated survival. They were facing severe resource shortages, and honestly, the prospect of competing on a global stage seemed entirely impossible.
Japan's economy had virtually collapsed. We're talking zero economic growth, extremely limited capital, and severe material shortages. Toyota faced a seemingly impossible challenge here. They needed to produce small numbers of many different vehicle models, and they had to do it with virtually no money. They literally couldn't afford a single ounce of waste in their system.
To really put this into perspective, let's compare Toyota's reality with the dominant system of the era. The American mass production model, the one perfected by Henry Ford, relied on high volumes, low variety, and massive, expensive machinery. It was all about economies of scale, right? You just punch out 1 million of the exact same part to lower the cost per unit. But Toyota's domestic market was tiny. They needed high variety, but in low volumes. They simply could not afford to copy the American model.
Toyota's leaders realized pretty quickly that carelessly imitating the American system would be disastrous, maybe even fatal to the company. The quote you're seeing perfectly sets the stage. A completely different production philosophy was born out of pure necessity. They had to innovate from the ground up, utilizing their own research and creativity to navigate their unique, resource-starved situation.
3 brilliant minds engineered this survival strategy over several decades. First, there was Seiichi Toyota, a master of inventions who actually started out in the textile industry. Then, his son Kiichiro Toyota, who founded the automobile division. And finally, the visionary industrial engineer Taiichi Ohno, along with Eiji Toyota, who painstakingly developed and refined the system right there on the factory floor between 1948 and 1975. And they were heavily influenced by the quality control teachings of American statisticians W. Edwards Deming and Joseph Jurin, who had come over to help rebuild Japan.
Let's break down their contributions, starting with Seiichi Toyota. He laid the groundwork by inventing a textile loom that stopped automatically the exact moment a single thread broke. This is a foundational concept called Jidoka, or automation with a human touch. Instead of a machine just mindlessly churning out defective fabric, it stopped immediately, preventing waste and signaling a problem. And this exact philosophy was carried straight over to the car factory.
Next, Kiichiro Toyota added the second major pillar, just in time. He realized that to completely eliminate waste, what the Japanese call muda, materials should only arrive on the assembly line exactly when required. Not a week early just to sit around gathering dust in a warehouse, and definitely not a minute late to cause delays. You make only what is needed, exactly when it is needed, in the exact amount needed.
Now, having a vision is one thing, but executing it on a chaotic factory floor, that is a whole different story. That's where Taiichi Ohno comes in. And here is a super fascinating piece of history. Ohno drew his greatest inspiration for executing just in time not from American car factories, but from a 1956 visit to an American supermarket. He observed customers taking what they needed and the store restocking only the empty shelf space. It was a perfect pull system.
Ohno brilliantly adapted that supermarket model to manufacturing by introducing the Kanban card. When a worker downstream needed more parts, they didn't just yell for them across the floor or guess the amount. They sent this physical card upstream. It was a totally unambiguous signal detailing exactly what part was needed, in what quantity, and when. The factory only built what the Kanban card requested. No overproduction, no overflowing warehouses. Just perfect flow.
So the really crucial takeaway here is that the Toyota production system evolved into a comprehensive socio-technical framework. It wasn't just a set of tools, it was an entire philosophy. It focused on flow and pull through Kanban, and utilized Jidoka to ensure quality right at the source. It championed Kaizen, which is continuous improvement by repeatedly asking why 5 times to find root causes. And maybe most importantly, it relied on a deep respect for people, treating frontline workers not as cogs in the machine, but as empowered, highly skilled problem solvers.
Crazy enough, for decades, the magic of this system was actually tacit. It was never even written down. It was just how Toyota operated. That is, until researchers Stephen Spear and H. Kent Bowen conducted an extensive 4-year study and published a landmark Harvard Business Review article in 1999. They managed to decode Toyota's DNA into 4 strict yet highly flexible, unwritten rules covering exactly how work is specified, how workers connect, how pathways are constructed, and how improvements are scientifically made.
In practice, these rules function as strict scientific hypotheses. Think about it. If a task is supposed to take 55 seconds and it takes 60, that deviation instantly signals a problem. The worker doesn't try to hide it, they immediately pull an Ondon cord to ask for help. It prompts real-time experiments at the lowest organizational level to fix the root cause. This essentially transforms the entire workforce into a community of scientists.
This framework soon evolved into an absolute global phenomenon. For a long time, the West kind of ignored Toyota, but when the 1973 oil crisis hit, sending global economies into a tailspin, American automakers bled money while Toyota remained highly profitable. This exposed Toyota's massive superiority and led researchers to study them deeply, resulting in groundbreaking works like Spear and Bowen's HBR article and the famous 1990 book, The Machine That Changed the World.
As a result of this intense global spotlight, Western researchers coined the term lean manufacturing to describe this whole mindset. It became wildly popular in the West as a generic term for systems aimed at reducing inefficiencies, designing out overburden, and building continuous flow. So when you hear the word lean today, you are fundamentally hearing about the Toyota production system.
This brings us to a major pivot. And honestly, the most important question for you as future healthcare leaders. Can hospitals actually learn from a car factory? Like, can the principles of assembling a Toyota Camry really translate to human health and complex medical care?
The answer is unequivocally yes. Just think about it. Just as car parts have to flow smoothly through a factory to avoid bottlenecks and excess inventory, patients must flow through a hospital system. When a patient waits 3 hours in an ER, or severe delays happen in lab results, that is muda, that is waste in the system. But in healthcare, waiting times and systemic waste don't just cost money, they cost lives.
Let's look back at Jidoka for a second. Automation with a human touch. Just as Toyota gave factory workers the absolute power to stop the assembly line when they saw a defect, forward-thinking hospitals use lean methodologies to empower their frontline staff. Nurses, technicians, and doctors are given the authority to immediately stop the line to address a medication error, fix systemic root problems regarding staff workload, and ensure patient safety above all else.
By adopting standard work to improve patient flow, reduce those agonizing waiting times, eliminate administrative and clinical waste, and truly prioritize patient safety, modern healthcare administration is leaning on the exact same continuous improvement methods Taiichi Ohno perfected decades ago. The 5 whys are just as effective at diagnosing a recurring surgical delay as they are a faulty car door.
So, can hospitals learn from a car factory? Absolutely. Because whether you're building cars or saving lives, structured, continuous improvement is the key to delivering exceptional quality. This has been QualityPulse, where we explore the ideas, people, and stories that continue to shape healthcare quality. Join us next time for another journey into the science and practice of quality improvement.